Greetings. This is Jonathan Fite, co-founder and CEO of Beyond Lucid Technologies, and I know everyone is busy, so I'm going to briefly take you through the process that fire and EMS agencies across the United States have begun using to track suspected COVID-19 exposures among their crew members, using the MediView TRIPS platform that was originally designed for and applied to community paramedicine and other forms of longitudinal charting, including the acute care of substance use disorder patients. This method was conceived by the Cypress Creek EMS agency near Houston, and the form that you're looking at is actually adapted from one that was and is being used by the Los Angeles County Fire Department for intake of patient information rapidly. As we have dialogued with agencies across the country, we've been very glad to find, and certainly understandable given the unified guidance from World Health Organization and the CDC, that the type of clinical information is pretty common being captured across the U.S. So what we're essentially doing is utilizing an intake form that streamlines the creation of patient records inside the MediView TRIPS platform and the correlation of those records into a patient profile, a folio of encounters and, in this case, of exposure forms that sort of bubble up to a single unified profile for an individual, in this case for a provider as a patient, that you can use to track this patient's health over time. So over a 7-day, 14-day, even 21-day period, you can see how this patient's numbers are performing. Are they getting better? Are they getting worse? If there is the need for a medical transport, a 911 transport of one of your colleagues because they are getting worse, you can actually pull in the EPCR associated with that transport, whether it was done using the MediView EPCR or any other NEMSIS compliant EPCR, and that chart can also become a part of the longitudinal record for this patient. As well, if you have some idea of when this patient's exposure occurred, you'll be able to remark the EPCR number for the suspected encounter record, so you can track back to the potential point of exposure. So just looking through this form, there's quite a bit of instruction that's being provided. We want to make sure everybody knows how to use the form. And I'm just going to fill in this information with some basic data for myself. So let's assume that the exposure happened on Sunday, so I would be in the 4th day of monitoring post-exposure. I'm going to use kind of just a fake number here. Let's do 1, 2, 3, 4, 5, 6, 7, 8, 9. You can see I've used this once before. I'm a male. Let's use my actual date of birth. So my date of birth is August 1st, 1981. Date of assessment is today. Time of assessment is, let's say it's actually 8 o'clock. And I think we said I'm on the 4th day of monitoring. Let's say I've developed a bit of a temperature. So I'm at 102. And to address that, I'm taking several medications. Last medication date will be now. Time will be, again, just a couple minutes ago. And I've developed some symptoms. So the exciting thing about the way that we've programmed this form is that when you indicate the emergence of symptoms, there is actually going to be a visible alert on the chart, in addition to placing these data within their respective and appropriate locations inside the patient care record that's associated with my profile. We are also going to provide a visible alert, because clearly if you're having your crew submit forms once, twice, maybe even more frequently per day, and you're checking up on them, you're going to generate a lot of records for these individual patients. Of course, we're stringing them along, but we also want to make sure it's easy for you to figure out which ones are urgent to respond to or to follow up on and which are not. So I'm going to submit this form, and we're going to do a part 2. I've just submitted the COVID exposure response video a couple seconds ago, and I'm going to log into MetaView Hub, which is where the MetaView TRIPS platform administration functions reside. So this is where we handle things like patient profiles and associated analytics, the aggregation of patient care records, both from our platform, from other EPCR platforms, and in this case, from the suspected COVID exposure tracking form, which generates essentially incident report forms or patient care record forms automatically that use the employee ID number to tie those records back to the profile for the patient to whom they belong. So we're just going to let the system log in here real quick. Takes a couple seconds. And if it looks like the system pauses for a bit, don't fret. There is quite a bit of information that's being loaded, both about the agency and about patients that we're tracking here over time. So there's quite a bit of information being brought into the system right now, and we'll give it just a couple seconds to complete the loading process. There we go. Okay, now notice when we log into the MetaView Hub portal, which is where the TRIPS application modules for longitudinal charting exist. The forms that came in via the online tracking form were not actually created by me as a crew member. So they're not showing up on my front screen here as if I had created them like a PCR. Rather, click the Show All button, and you'll see that there are a number of forms that have been created that are tied to the agency itself. So they show up on the agency records page, and there, right there, you can see the record we created. Day 4 is the period, the point in my tracking of my illness, my fictional ID, and so on and so forth, the date and time, and this indicator, as we talked about, that suggests that this particular form indicates that or contains details about my symptoms. So if there were no symptoms indicated, there would not be an alert here to make sure we open that one. But first, before doing that, what we're going to do is actually open up the profile section. And what we've done here is, let me just say, the MetaView application is a thick program. There's a lot in it, ranging from 911 EPCR to patient tracking to hospital interoperability. And in order to facilitate the use of this program in rapidly tracking crew members who may have been exposed to COVID-19, we have tightened this program up. We've squeezed it down so tightly that in the video preceding this one, you saw Los Angeles County Fire's nursing team, part of the health services team, that are tracking the internal crew and their own health, complete an encounter record in 1 minute and 19 seconds. Again, 1 minute and 19 seconds from the import of a profile into a record to the completion of that profile in a fashion that is NEMSIS compliant. So we're going to show you how to do that here. You're going to go into the profiles section first, and we want to look up whether we have any profiles, and it turns out that we do. This profile was automatically created the first time that intake form was submitted. Again, the first time the intake form was submitted, the system is using the EMS patient ID to generate a new profile for that provider patient. So this is for your internal people who are under observation or in quarantine, etc. And the first time they submit this monitoring form, they are the profile is being created for them. If you don't have them create a form first, you can also utilize, for example, the create Create Patient Profile from Agency Personnel button, or you can even use from a patient care record, or just create a new profile from scratch. So you have that option up here. You can find more details in the manual that accompanies this video. But the first time you create the profile, submit the form and create the profile, and every subsequent form that you submit over the next, say, 7, 14, or 21 days is going to create a record associated with that particular profile, and we're going to look at those in a moment. So in this section, what you're able to do is see those past encounters. You're able to schedule a future encounter if you need to have a checkup on that person. So let's say you're going to be establishing a process to check in on your high-risk observation patients, the ones who've been sent home sick, etc. On the afternoon of every other day or every day. You can set up those appointments, all those folks. You can view the action items of what you need to do to take care of those folks, and sort of reminders that have set for yourself in terms of physicians that you may need to contact, pharmacy you may need to contact, etc. All the things you'd expect to see in a community paramedicine oriented task tracking module, but in here we're going to be applying those to the crew themselves. And then of course you can schedule the actual encounter, and you can create a record from the profile. And so that's actually what we're going to do in a moment. But first, let me open up these past trips so you can see that the first record that was brought in is already there. So this is the information, this is the chart that was created this morning when we filled in that tracking form, and it automatically generated the record associated with that form and that patient. So there's the patient number, and when I click Show Vitals, it pops open the information about that call. So you can see what was entered, you can see when it was done, and so on and so forth. You see when we took the vitals. All the information that we captured is all right here, and you can actually pop open the record itself. So if you wanted to see more detail than is visible right there, you can see the individual symptoms that were captured and the temperature, for example, that was captured. So you can easily see in a folio style, again, like a longitudinal electronic health record, which essentially is what this is, you can see all of the information. So I've closed out the chart that we were looking at in the past trips section, the past PCR section, and I'm back at patient management. Now I have a couple options here. As we talked about, I can create a new patient profile. If I need to, I can create a record directly from the profile, which we'll do in a few minutes. But for now, what I'm going to do is I'm going to exit profiles. And because the forms that are coming in an automated fashion are not generated by me, and I'm logged in as me, they are not showing here on the My Records section. But if I click Show All, you'll see past forms that we have brought in, including the one that we imported earlier this morning from the automated intake form. So that's actually what I'm going to open up right now. There are no cohorts assigned here yet because this is a generic account. So in your actual use case, in your account, the cohort into which the patient is situated, which could be things like medium, low risk, medium risk, sent home sick, quarantine, self-isolation, and so on and so forth. I'll show you some of those. Those are going to show up here as part of the chief complaint, so you know who is where in your program and what day associated. But for now, what I'm just going to do is I'm going to load this record, and I'm going to start by going to the incident section here. And what we want to point out is that based on the initial construction of the system, the fact that this record was brought in through that automated fashion, you've got already a number of pieces of information filled in. And when we go down to the assessment section, for example, what you'll find is that I had registered myself as being on day 4 of the program, and here are the signs and symptoms that I indicated I was experiencing, right? So these are now my complaints are already entered into the resultant record. Also, notice there's a 1 on the vitals here. When I click on that, I took my temperature, and there's the temperature value in Fahrenheit. So you can see when the information was captured, it was brought in on the form, and all the information is already pre-populated. Additionally, under the medication section, remember I had indicated that I had taken certain medications and when I took that medication based on the time that I entered on the form. As it happens, you'll notice that there's a little bit of a time difference between what we had done on the form, what I had entered, and what's showing up here. That is actually the result of a time zone difference. So this particular agency is set to East Coast time. I am in California, so there's a 3-hour offset between the time that I entered the form and what you're seeing here on screen. That's what that is. So it's not an error. It is a time zone offset. The form will utilize, and when it hits your system, it will utilize your local time zone to fill in that information. So again, all that information is already populated that I brought in from the form, and that's quite a bit of detail as to what is this patient is experiencing. Now, what we did is we essentially took the extensive detail of the Mediview platform and we squeezed it. And so we're utilizing our templates tool, which, as an aside, is the single most beloved tool that we've put into the field in more than 6 years. And when I hit apply template, you're going to see a number of pre-populated templates that are designed to be associated with tracking patients who are experiencing suspected or confirmed COVID symptoms. So what I'm going to do here is I'm going to select several of these. I'm going to select that this patient is in high risk for the moment, and that they are experiencing respiratory issues. In fact, let's do pneumonia and acute respiratory syndrome. This person's having kind of a bad day. They are a male patient. Notice the instructions here say select the gender, fill in the complaint duration, and the clinical details. The complaint duration was automatically filled in from the form, so there's not actually something you need to do there. But if you were doing this from scratch as a new encounter record, say for example you were doing an over-the-phone follow-up and there was not a form that had been created, you would actually go in and fill in the complaint duration and the clinical details based on what your colleague has told you. Have they traveled outside the community? Let's say they have not, and they have not traveled internationally. One thing that's worth knowing is that we have built into Mediview the COVID-related data elements that are being recommended by the CDC, World Health Organization, various states. So as we select these, you're going to start to see those populate. I'm going to hit confirm. It's going to ask me to check a couple things. There's some conflicts between what was there before and what I selected. So I'm putting this person into active monitoring, or are they on day 4? Let's say they're in active monitoring, so I'm selecting that one. Their primary impression is whichever one I choose. So in this case, let's say that they've been exposed. That's the primary. So it applies all of these templates automatically. You can create additional templates however you want. So these are the items that were already selected on the call type. And now when I go through and go back into my various sections, my incident section, for instance, has been updated. So now based on the COVID identifier and the data in that template, we've changed the dispatch complaint from a well person check to a sick person, for example, and other data elements have already been pre-populated into the system. The templates are generally not designed to put in patient information, because how would you know that, right? So those are intended to, the patient information fills in from the profile. The template is designed to quickly help you fill in the clinical details and the NEMSIS statistical details and so on. And so in fact, let's take a look at those right now. We can run the validation. And that's exactly what we're going to do. So in an ideal world, we should see that there's not a whole heck of a lot that needs to be filled in, because the template's already done a lot of our work for us. So we're just going to run that validation. And notice, crew member role, let's go back to that. Click the link, it's going to take me over there. So I'm going to run my validation again. That one's good. There's some more information we need to fill in, some more information. What we wanted to do, and what we want to do, is squeeze this thing so tightly that basically all we need to enter in is times, since those are not going to be known by the system automatically, and a couple other discrete pieces of basic information, in addition to whatever clinical information you've chosen to enter on a particular call. So check it out. Notice times. That's pretty much the only thing. And crew role. Narrative is required for these particular rules. So patient is in day 4 of monitoring. And we're going to go to the times section. This is when we have the initial time. That's when the form came in. And now when we're done with this encounter, that's what we're going to put in there. Rerun our validation. And, oh, there's person's ID needs to be entered, so let's just put that in. Guess I missed that one earlier. Okay, nevertheless, pretty quick, point by point by point. Everyone who's done a PCR is pretty familiar with ePCR structure. So what we're essentially allowing you to do is run the rules to tell you what information you need to capture. Based on your local rules, you may have additional things you need to capture or not. So there you go. Okay, and we're good. So now what we're going to do, just make sure all of our clinical information is captured as we want to take a look at it, see all the detail that I captured in. Again, the COVID-related data elements, the symptoms, and so on and so forth. COVID data, by the way, current section, notice you've got the travel information, for example, and in your drill down for patient history, COVID. The account in which I've been showing your demonstration is a generic one. It didn't have a whole lot of information in it. It was really intended just to give you a sense of how the pieces come together and how you would navigate through the system. But at the moment, I want to show you an actual account. So this is, I have on my screen here, the Los Angeles County Fire account. There is no HIPAA data, there is no personal patient information shown on this screen. But what I want to be able to show you is how the Mediview Trips platform brings in the forms from the self-tracking and the monitoring form that we showed you earlier and combines it with the cohort assignment associated with your patients. And it actually tracks the cohort and the day that they are under observation. So if you've got somebody in, a 7, 14, or 21 day period, and they are going to move either hopefully down in terms of their exposure, but some people are going to get sick, some people may have to go home, and so on and so forth, and you can track that through the system. So you see some people are self-monitoring, some are at medium risk. I'm going to show all, which is actually going to show you some others. So there are some who have gone home and are on their 8th day of having been sent home. There are others who are low but slightly enhanced in terms of what they're looking for, basically making sure that they are, while they have some symptoms, that's what this red exclamation point once again is all about, they are under observation to hopefully not get any worse. You've got some folks who are on over 2 weeks of observation at high risk showing symptoms. So the idea is that you can group these, you can sort by the column and make sure that you are observing your various cohorts of provider patients as they move through the system. And that way, especially as COVID-19 spreads and the numbers simply grow, you'll be able to triage your engagement of your own crews accordingly. And again, this is all built into the application. As you fill in the form and submit those forms, they will then correlate automatically with the cohort group. Each agency's employee ID can be used to then essentially create these longitudinal electronic health records for their patients. If you have any questions, contact us, www.beyondlucid.com. Thank you.